This is really, I got real briefly, this has been an amazing morning, and you talk about getting inspired about what you do and what disappointed about what you're not doing. This is a great way to see this because there's so much potential. And Dr. Francis Goody, who I will not read his credentials again at his request, will be actually coming up to give an overview for this panel. But I want to mention the other people who are the panelists. And they asked me not to go in depth, but I do want to explain a few of the things. There's, first of all, is Ruth Mcdermott Levy. She earned her baccalaureate degree from Wilkes University and her master's and PhD in nursing from Villanova. She is an assistant professor of the College of Nursing and teaches community and public health nursing. She has a keen interest in environmental health and has served as co-chairperson of the Pennsylvania State Nursing Association's Environmental Committee and the Alliance of Nurses for Healthy Environments Education Work Group. She is currently working with other nurses in the region experiencing unconventional natural gas extraction to educate health professionals about the health impacts of these extraction methods and how to advocate for policies that protect public health related to extraction activities. Marina Gallo is from Pittsburgh, Pennsylvania. She earned her BA in English from Bryn Mawr College in 2009. Following graduation from Bryn Mawr, she decided to pursue nursing and enrolled in the College of Nursing's BSN program for second-degree students. While at Villanova, Marina was the College of Nursing's first student representative to the President's Environmental Sustainability Committee, and in that role, she developed a project to reduce trash and promote recycling to the College of Nursing's Learning Resource and Simulation Center. The program was designed to replicate hospital waste and reduction programs. She graduated from Villanova in 2012, and she recently accepted a position as a staff nurse at the Children's Hospital of Philadelphia in the surgical trauma unit. And finally, John Farrow was raised in Northwest Indiana, 10 minutes outside of Gary. He joined the U.S. Navy in 2001. He served on the USS Louisiana, a ballistic missile submarine, and was a member of the Emergency Medical Assistance Team and volunteered as an EMT in his community. He is currently completing his Bachelor's of Science in Nursing degree, after which he will be commissioned as an ensign in the United States Navy Nursing Corps. So I want to welcome everybody.
So, I mean, I like to practice what I preach. You can hear me? So, I'm an emergency doc, so we stay cool and calm under all circumstances. So, I'm assuming I've only got about 3 minutes to do this, 3 to 5 minutes. So, I'm going to just show you the power that exists in 2013. So, get out your cell phones or laptops, fire up your machines. Environment-related health problems. I'm supposed to give an overview of that, right? So, I'm just one brain amongst a million very sharp brains. So, you guys, let's do it together. So Google what you want around this issue, and then when you find something, just start shouting it out. I'll tell you one thing as you're doing this. I'm worried about the bees. Because without bees to pollinate our fruit, we're not going to have fruit to eat. So, like, who's worried about the bees out there? But there's been a sudden drop of bee activity around North America. So you're going to have trouble finding fruit. The only thing that I can remember about the environment and health is George Carline's brilliant skit, where he basically says, you know, we're also concerned with the planet, but the planet really is not concerned about us. Because if we screw things up, the planet will just get rid of us and start all over again. So for those of you that think that the planet itself, Mother Earth, is worrying about what we're doing to her, she's not. She'll just get rid of us, and we'll start all over again. So who found something around environmental health that we should talk about? What's that? Smoking. Well, smoking's a big one. So indoor environment health, outdoor as well. What else did you find?
Fracking.
What's that?
Fracking.
Oh yeah, fracking. Now that's a real one. That's a real controversial one right now. But you really better get to know a little bit more about fracking. Fracking is good in the sense that you're getting more oil and gas out, but there's a lot of people that are really questioning its impact on the aquifers out there. What else have you found?
Global warming.
Yeah, global warming, I mean, it's kind of hard to deny that global warming is taking place, right? And I don't think it's, some politicians say it's the methane coming from cows that's blowing, that's warming the earth. I think that's a little bit of BS. I mean, there's some real issues around global warming that we have to address. What else is there? Air pollution, well, obviously smog and vehicles. Like, why do we need vehicles in the first place? We need vehicles to get us from point A to point B. Our communities were designed specifically so that you have to have a vehicle. And not only one vehicle, but several vehicles to get around. You know, take a look at Europe. Getting rid of vehicles and using more mass public transportation actually forces you to talk to someone, creates more, interaction. And the way we're creating our society directly impacts on the environment. What's another one, somebody come?
Plastic.
Oh, plastic, yeah. I don't know if you know, but there's a circle somewhere in the ocean where all the plastic scrap from the world is coming together, and it's killing an enormous amount of marine wildlife. That's a collection of plastic that's just dumped into our environment. What else have you found? Avian flu? Well, the trouble is, right now, environment impacts on flora. And insects and all sorts of viruses that normally were minding their own business are all of a sudden finding a reason to come out from where they've been hiding. So we're going to see a lot more new diseases show up that we never experienced. Over there?
Cancer clusters.
What's that?
Cancer clusters.
Oh, cancer clusters, obviously. I mean, take a look at the tar sands, what was yours down here, Love Island, or 3 Mile Island, Love Canal. There's thousands of them that are out there. We probably don't know about the majority of them because they've been buried quite discreetly. Actually, what was that? I was at an outlet store the other day. What were those 2 big towers? Is that a nuclear power plant?
Limerick.
I thought I called them. What else? Put up your hand. Yeah, right there. Oh, pesticides. I mean, the whole story of Silent Spring Rachel Carson. It's still going on. Still going on. And the fruit you eat you think is clean, you don't even know where the heck that fruit came from. So you don't even know what's on top of that fruit from a biological perspective and a pesticide perspective. That's a big issue because probably the next big terrorist attack will, I think, personally come through our food chain because we're kind of sloppy with our food chain. Actually, don't say stuff like that in the States. I'm sure some FBI agent's going to stop you at the border and trying to get out.
Clean water.
Yeah, clean water. Water will be to us what gold is in terms of preciousness. And as a matter of fact, who was the idiot that came up with this idea to bottle this stuff and sell it? Like, who would buy it? Sorry. Down there? Is there anyone else? Oh, our kind of farming today, you mean the mega farms and stuff like that? Yeah, you're absolutely right. It's so funny. At the turn of the century, the family farm would, know where its cattle was coming from. Now you buy a hamburger, it's probably the combination of 3,000 cows from around the world. In the old days, it would come from one cow. All the stuff we used to do in the old days, we now sell it and we call it organic and charge a fortune for it. We're pretty dumb as humans, aren't we? Males especially.
Other chemicals besides plastics that cause, they may be solid to begin with, but they cause volatile gases.
Yeah, I'm not an expert, but it's kind of funny that we can't solve this cancer problem, yet every year we come up with 1,000 new different chemicals and find uses for them. Something as simple as in your shampoo. We're starting to see all sorts of weird things in our animals. Like fish and frogs and tadpoles and snakes, and that's all the stuff we flush down the toilet. So I think that in that brief overview, you could see the power of working with your audience, using the internet, and getting collective wisdom. That's what we should be working at. The days of working independently are over. What we have to do is start developing collective wisdom. And to develop collective wisdom around this issue means that we literally have to exhaust our approach to dealing with this issue. Anytime you want to solve a problem, try and find out why is it a problem and what are the forces working against you. And you've identified quite correctly a lot of the forces that have vested interests to continue to do what they do, and we as a society pay the ultimate price for it. So hopefully that set the stage for how complicated this topic is, and I leave the complexity to the rest of the panel. My job is to just simply introduce it.
It's interesting to go to the panel now. I was getting overwhelmingly depressed as I heard of each and every problem. 2 things. One is, to your point, during his talk, or the following talk, I tweeted that 30 minutes of exercise a day is probably worth more than all the medications in the world. That was retweeted by KYW News Radio, which was then retweeted by CBS Radio, and it just got picked up in the New York Times. boom, 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 all is big, and that is the power we have with good information. The problem with bad information too, you could say something equally harmful and possibly get it out there. But the second point though is getting all depressed about all these problems, which I was. I realized, wait a minute, we have 3 people here who are now trying to attack these issues and do something about it. And I think that's why we're all here today. We know the problems, so how do we address them? What do we do, and how do we try to make things better? So I want to start with Ruth Mcdermott Levy, who is going to talk about environmental influences on chronic disease in the United States. So, okay, that's great.
But it's pictures, so don't add. And, oh, wait a minute, I'm so technological. There it is. Okay. And just to echo what Dr. Liu said, first of all, I agree with him, or we had an agreement that I can call him Dr. Liu because I really mess up his last name, but he said that there were 3 factors that influence disease: exercise, nutrition, and something else. Smoking, okay. And I sat there and went, so with all due respect, Dr. Liu, I also say environment, and it is not just smoking. There are many, many factors that influence our health related to environment, and that's what we're going to talk about on this panel very briefly here. And as you heard from everything that everybody shared when we were doing the exercise with Googling things, it's vast, and it is pervasive, environmental things. So I'm just focusing on the chronic diseases, and I actually narrowed it down to 3 areas within the environment: of air, chemicals, and climate change, which someone had mentioned as well. So if you look at our 10, oh, how come it's not showing up there? Thank you. Okay. Now, oh, it's moving. Okay. Sharon. I don't know what's going on. Thank you. So as she's pulling this up, because I know I don't want to hold up much of this, but what we're going to look at is the 10 leading causes of death in the United States, and 7 of those are chronic diseases. And arguably, you know, in my worldview, they're all related to the environment, all 10 of them. But certainly, the 7 chronic diseases are, and we're going to go through that in a moment. Where's that? Thank you. So they're there. Thanks so much. So there are the 10 leading causes, and as well as the chronic diseases are listed in green, and we're going to talk about the environmental influences of those. And like we just went through in the exercise, we know, everyone in this room knows, that the air we breathe, the water we drink, the food we eat, the products we use that were mentioned with plastics, and the energy supporting this conference today, including the energy to recharge those smartphones that we all have, influence our health in consistent and subtle ways. And so we will look at those subtle ways with our air pollution, first of all. And when we consider the 4 leading causes of death in the U.S., which were heart disease, cancer, chronic lower respiratory disease, and stroke, they are all influenced by air pollution. There are also indications that air quality influences diabetes, and I'm going to share the evidence with you in a minute, and also then influences hypertension and diabetes, which then in turn influences renal disease, which was the 7th cause, and I see Dr. Pierce shaking her head back there. So it is environmentally related. So let's look at the evidence that's related to this. Myocardial infarctions and atherosclerosis have been associated with rises in fine particulate matter. The Environmental Protection Agency is also working with Duke University and researchers there to see the relationship with atherosclerosis and MIs with ozone levels, okay? And these are all things that you hear reported on the news. KYW reports when our ozone level is high, so these are things we need to worry about. The EPA has an initiative called the Green Heart that is just for healthcare providers, and our senior nursing students should be able to tell you about that. To educate so healthcare providers, the EPA is working to get us all up to speed of how we can protect the health of our nation. A Canadian study by Villanova and colleagues that was published in 2012 has identified that higher particulate matter and ozone and carbon dioxide is associated with not only stroke and heart disease, but diabetes, and it is people who are greater risk who already have these problems. So they have a greater risk of MI and stroke as well as if they already have these problems. So that means our elderly are among the vulnerable. So they are who we need to reach out to. And if that is not enough, because this one is really disturbing, we all knew about the cardiac, we all knew about the lung disease, and we know that cancer with the chemicals in the air is influenced as well. So chemicals in the air can cause cancer. But what they've also found, Lou and colleagues found that the inflammatory process from fine particles in the air influences our ability, it creates insulin resistance and our ability to metabolize fat. So that's associated with type 2 diabetes. So that's a problem. This is just breathing. We're having these problems. It's not all the other exposures that you talked about. So we do need to do something about this, and certainly nurses are positioned in the best place to speak out for what's going on in the communities. Also, what was mentioned earlier this morning was about the cost of health care. And a study in California looked at asthma admissions related to air quality. And in a 2-year time, they found that the expense of asthma hospitalizations when the air quality did not meet the federal standards was over $766 million. That's one state. California's a big state, but that's one state in 2 years. And what could we do with that money? I mean, it could be so much better spent. That was money that was being spent by Medicare, Medicaid, and private insurances. Again, a place where nurses can work with insurance companies to help work, articulate these problems to legislators and articulate to communities so we can make a difference. And perhaps industry. As far as chemicals, and I know, I think it was Betty Keach that mentioned the plastics. Chemical exposure has also been found to influence chronic diseases such as cancer, diabetes, Alzheimer's disease, and other neurological diseases, including Parkinson's disease. One group of chemicals known as the hormone disruptors have been found in pesticides, flame retardants that are on our sofas we're sitting on, plastics such as bisphenol A, which is also BPA, toys, cosmetics that were just mentioned, sunscreens, some cleaning products, air fresheners, and hair dyes. These are things are in our house. Hormone disruptors have been implicated in contributing to the development, again, of cancer and diabetes, and they've also have contributed to our metabolic processes and obesity. So again, our relationship with what we're seeing in the health of our nations. This is a problem. People mentioned about pesticides in the foods that we eat. Another group of chemicals, again, the pesticides, are related with chronic disease, again with Alzheimer's disease, cancers such as breast cancers. There's a synergistic effect with pesticide exposure and breast cancer, diabetes, and then other neurodegenerative disorders. Villanova nursing students have been working with communities outside of, in immigrant communities and other communities, educating people about how to use products in the home, how to use safer products that don't expose their families to these issues. And Villanova nursing students have also worked here on campus with students of how to use safer products and how to reduce pests in their dorm room and everywhere else so that they don't have to even use the pesticides. And it is possible. to not have to get out that can of whatever you're using. I don't want to implicate any company, but it is possible to get away without using pesticides. And that brings us also then to climate change. And you may wonder what that has to do with chronic disease, and of course I'm going to say everything. But this picture actually is of Haiti, and this was taken during Hurricane Sandy. I know many of us were influenced by Hurricane Sandy, so I didn't want to use a local picture. But also this is a reminder that when things happen here, they also happen further away with people that may not have the resources that we have. So that's something for us to keep in mind when we're experiencing things. But as far as the chronic disease and climate change, again, thinking about our patients that we see and how they're doing on extreme weather situations, and how, when there are extreme weathers, like a Hurricane Sandy, can people get to the therapies they need? Can they get the medications they need? And all those sort of resources. So that's something, again, as nurses, that we need to plan for. The other thing is we see such extremes in heat in this region. We need to plan for, again, the most vulnerable, our elderly, young children, the disabled. And again, Dr. Kara, for the renal patients, what renal nurses that work in dialysis are reporting, that they're having a really difficult time managing the fluid and electrolyte balances during extreme weather, extreme heat. So again, this is something that we can't just say, oh, climate change, doesn't affect us. It affects our practice in every way. So we again need to think about that. So, in conclusion, we need to deal with the elephant in the room. In 2011, the Institute of Medicine published The Future of Nursing, and we all have used that to guide our curriculum changes, and it really highlighted what nurses are able to do. That we are recognized for our versatility and adaptability, and to adapt to trends in healthcare. It also recognized that we're able to meet the needs of the poor and the vulnerable, and how well we do that. But there was another study that in 2000, it's not in 2000, actually it was in 1995, about how nurses, by the IOM as well, and that was titled Nursing Health and the Environment, Strengthening the Relationship to Improve Public Health. And what this report called for was that nurses need to be better educated to meet the needs of communities related to environmental health. And so not only is the Future of Nursing report important, but we also need to go back and look at what other things the IOM has recommended for us. Since that IOM report actually took 15 years for the ANA to the American Nurses Association to include in their scope and practice environmental health and care for our planet. So, and considering the health needs of our patients. So it is time for nurses to address the elephant in the room. And we need to meet our professional responsibilities by addressing those factors. Our recent graduates are very well prepared to address those needs. So it's exciting to see that, and we have some examples here. And so I believe, Marina, are you the next?
Marina is next, yes.
Mm-hmm.
Okay, my name is Marina Gallo. I'm a recent graduate of the alternate nursing program. And during my time at Villanova, I was able to do a pilot study about the reduction of waste in the nursing learning laboratories. So before I start talking about the study, I'm going to talk about a little bit what's going on in hospitals today. And hospitals are huge producers of waste. An estimated 6,600 tons of trash are produced a day, 85% of which are non-hazardous solid waste, which means it could just be sort of like hospital, hotel kind of waste rather than medical waste that needs to be treated in a certain way. and about $8.3 billion a year is spent on energy by hospitals. Some of the methods that are used to get rid of hospital waste is incineration, irradiation, and dumping in landfills. So this creates a lot of environmental pollution, such as methane in the landfills and dioxin carcinogens that lead to illnesses, like Dr. Levy mentioned. And then some of the good things that's going on in hospitals to combat some of these problems is the creation of green teams, groups of people who try to come up with some solutions for recycling and lowering the energy consumption. Task forces and committees, similar ideas. There is education, which has proven in many studies to be essential to having these programs be effective. And along with that comes cost reduction. They've found that recycling and making concerted efforts to reduce the amount of materials we use and dispose of has proved to be very good for the bottom line. Some examples that are local to the area are Abington Memorial Hospital, which has a fantastic program that actually started as far back as 2000. And they've taken part in many pilot programs to reduce waste and have done very well and won some awards for that. Mainline Health has also taken part in a waste reduction pilot program, and there's a whole grouping of other hospitals that I haven't mentioned that have taken part in separate sort of pilot programs and started the process of reducing their waste, being more environmentally friendly. And this water bottle I actually brought as an example of something that's being done. Smarter purchasing. This is 100% recycled plastic. And though this is a small step, if hospitals are going to insist on purchasing these kinds of things, this would be something that the green team would look for. Two concepts that were essential to this project that I learned. When I came into the nursing school, I naively thought that nurses mostly were at the bedside in hospitals. And luckily, I found out that they're much more than that, and they can take on many roles: teachers, managers, and outside of just hospital work. There's a lot for nurses to do. And that patients are more than just that one person you see in the bed, and they can be the whole family or a group of unrelated people, and the community, which is the most important part related to this project. Okay, so how I ended up doing this, I'm going to give a small example of what led to everything. I did a lot of shadowing of doctors and nurses before I started nursing school to make sure this is what I wanted to do. And my dad's a physician, so I went with him to the hospital he works for. He's an ophthalmologist, and he would do cataract surgery. And his hospital has absolutely no recycling whatsoever. So for one patient, they use 8 5-milliliter bottles of eye drops, and they're required to dispose of each bottle after using 1 to 2 drops. So that's one patient he sees one time, and that's just a small example of how much waste goes on. So I grew up recycling, and I always had that understanding that it was important, but I didn't really make the connection of recycling and environmental awareness to our personal health. And once I did, and had that frustration with how much waste is produced in hospitals, I luckily was introduced to Dr. Levy in one of my clinicals and was venting to her about how upsetting this was and overwhelming. And she suggested that I do something, and what I could do was take on an independent project. So to do that, I applied to the President's Environmental Sustainability Committee at Villanova, which is a group that does independent projects. It's faculty, staff, and students, and coordinates these projects to promote sustainable practices and policies on campus. And as part of that, they implement the president's climate commitment on behalf of the president of the university, which fulfills the same goals, promotes environmental awareness. And so, to the study, my goals for this at first were massive. I thought I would create huge amounts of change, and I had to reel myself in to be more realistic. So I chose to try to implement recycling bins in the nursing labs downstairs. And I wanted just to reduce the waste and to mimic what certain hospitals are doing, so our nurses would go out prepared and ready for the environment they would be working in and could be leaders in promoting that. And also just to create an awareness of the problem. So what I did is a trash audit of a catheterization lab, and that involved collecting all the trash, sorting it, weighing it, and then after that happened, I just did an education session where I talked to the students of the next catheterization lab about recycling and its importance to nursing and healthcare in general and the effect on our health. And then did another trash audit to see if that had any impact on their recycling. And I'm going to talk about the results. The first trash audit, there were 20 pounds of trash, and 14 of those 20 were recyclable, but nothing was recycled. In the second trash audit, there were 24 pounds of trash, and 8.5 of those 24 were also recyclable, but no one recycled, even after the education education session. So that was incredibly disappointing, but Dr. Levy helped me sort of reframe that and see the positives. And some of the positive outcomes were that it started a discussion among the faculty, staff, and students, and brought this issue to light, and that the recycling bins are in the laboratories now, which is a good thing. And that the labs are taking that step to more closely mimic hospital settings. The possible barriers that I found was that it was a very small sample size, so I don't know how realistic or how accurate the results can be. And possibly poor timing. The students I did the education session with were coming to me after 3 hours of lecture and a huge test, and they were exhausted. So I think, as many studies that have done this in hospitals pointed out, education is essential to keep this going and to initiate it in the first place. And if I were to do this again, I would use some tighter controls to make my results more accurate. Why this is important for nurses? Like everyone, our health is affected, but nurses have been shown to have some of the highest rates of pollution, hospital-related asthma, as with the cleaning personnel. And we're also taught to be patient advocates. So if we're looking out for their health, it can't just be in the hospital. It has to be preventative medicine, which has come much more to the forefront. And we see these problem areas firsthand. So on these committees, we can point out areas where we might start to recycle or use smarter purchasing products. And nurses comprise a huge percentage of the staff, so there's a great opportunity for people to come from every sector of the hospital and push for this change and hopefully get the ball rolling to help with the health and reduce hospital costs. That's it. Thank you.
Thank you. Our final speaker is John Barrow. And John's going to be talking about environmental justice issues in Philadelphia while doing a home care clinical practice.
Well, nothing like being the last guy before lunch, right? So, good times. I was asked by Dr. Levy to talk about the environment in nursing from the nursing student perspective. So after lots of research and worrying about all the possible ways to die from chemicals that I can and cannot pronounce, I realized I was getting lost in the details. Villanova has taught me asking questions is vital, but asking why are we asking these questions and what values we have attached to these questions and what we're seeking is more important. So what is an environment and how can it affect a person? To answer either question in a nursing classroom, the fail-safe answer is it's multifactorial. It covers all your bases. It's a great way to hedge our answers. Rarely is a condition the result of one single factor. And I believe we learned this before stepping into a nursing classroom. It requires us to unpack values and concepts, and that's what I hope to try to promote here today. So, what is an environment? Let's see if this works. Is this? This? How about that? Detroit. Or this? What values are we attaching to these things when we look at them? What are we saying to the patient by our values, or what words we use when we see something like this, when we walk into a room? And what values do they attach to these, and how can we use these to promote health promotion goals? So my short experience in the clinical hospital setting has shown me that the values associated with an environmental factors are quickly forgotten when nursing in the hospital. Computerized charting, multiple medications, multiple patients, staffing shortages, and just a high tempo, the ICU or wherever you're at, makes you forget about them and just focus on the diagnosis and treatment. My public health class with Dr. Levy has trying to help remedy this issue by talking about public policy, environmental factors, and the relationship they have to nursing. We have a group project, and our group project is to monitor and look at zip code 19121, which is the area around Temple. So to give a mental picture, it's 2.3 square miles, 23 facilities have reported hazardous waste activities in the area receiving F in high ozone days and particle pollution from the American Lung Association. How does that affect those people in that setting? While driving through our project zip code, taking photographs for our project, the amount of trash on the street, derelict buildings, and lack of green space made my partner and I feel like a stranger in a strange land. The question, how does this affect the relationship between the inhabitants and the welfare of their neighborhoods and communities? My limited perspective says it alienates the person from the community and the environment. The person tries to insulate themselves, protect themselves through things and television. And my current clinical assignments in North Philadelphia have confirmed these ideas. My first patient is a fiery elderly lady who is unabashed in giving her opinion about anything. Upon entering the Section 8 housing complex through 2 gates, 2 locked doors, and knocking on a few other windows to get in, my partner and I were taken back by the smell of menthol cigarettes and the fact that we were there to visit about COPD exacerbations. Our visit in the living room was wonderful. Leather couches and a large flat-screen TV with the blinds tightly shut. After seeing her pulse ox drop to the low 90s, we asked her why she didn't have her oxygen on, and she said, "I didn't need it, and it's annoying walking around the house with it." So after explaining the purpose, she told us, "I pay my doctor to tell me that, not you." So we tried again to tell her about her diabetes and the fact that it's uncontrolled, and we met with a similar response of, "I will eat what I want, when I want, and I don't care." She told me, and my purpose was to get her a shower chair, fix the motor scooter, and get a humidifier for the oxygen when she needs it. This patient has lived in the same area her whole life. How does the environment affect the culture and the outlook on education, specifically medical education, and how can we use it to promote it? As a behaviorist, B.F. Skinner said, "An organism behaves as it does because of its current structure." Is that too much for anyone to overcome? My second patient is a 56-year-old who has a tracheostomy, laryngectomy, and a G-tube. She received a tracheostomy and laryngectomy related to smoking, secondhand smoke, and working in an auto repair shop for 22 years. Going into her house for the first time, dark, uneven staircase, steep, shoddy handrails, and she lives in a small, tiny room at the top of the stairs, maybe 8 by 10. Hospital bed takes up most of the space. Her room's cluttered, so I can't open the door. I have to squeeze in sideways. My partner waits on the landing outside. No flat surface available. Paper, clothing, memories, and medicine fight for the space. She's lucky enough to have 2 windows, but they're shut, with blinds, again, tight. The walls are fake, wooden paneling with black grime creeping down from the ceilings, and a lone light bulb hangs out from a junction box from a stained drop ceiling. She's lucky enough to have an AC, though. with multicolored molds on top and a heater plugged and stuffed underneath your bed. During her only outlet is a 20-inch television, and recently it was Maury Povich and Cheaters. How does that affect the patient and her outlook? At the end of our visit, she broke down in tears, emphatically told me, whispering, mouthing the words, she's done with this. She's done with the pain and wants everything to be over. Now, would she have the strength to continue if the environment was different? If she was on the main line or on the Jersey Shore? Would it change? Now, I admit I am biased to the idea of self-determination from the military can-do attitude, but I like the idea that it's not a math test, it's not just numbers. It's passion that's going to make anything that you do, and you can overcome it. But my bias does not relieve me of the facts and my duties as a Christian and a nurse. As I learned and remembered all the time, a nurse is a patient advocate. Maybe a health advocate would be a better way to look at it. And doing my job on the hospital floor is not fulfilling my duty. I must educate and advocate for patients at a different level, at a level beyond the bedside. And I think Villanova has given me the skill and theory to be a great nurse. But what's more, it's given me the ability to see a situation through multiple lenses, and it's challenged me to ignite change. Thank you.
Questions that I'd like to start. Actually, why don't I do this? Because lunch is beckoning. Dr. Francis, maybe you could summarize what you heard. You're great at doing these wonderful things and just wrap it up for us.
Well, you know, it's 2013. There's never been a greater time to meet the challenges of the world than today. I mean, we're about as smart as I think we're going to get. I don't know if we're going to get much smarter. And I sense that there's something in Generation Y, sorry about that little joke, but Generation Y really reminds me of our generation, the 60s. I mean, from what I remember the 60s, I mean, we really used to take issues and run with them. And that's what I sense with this current generation. So I think that I'm going to bed feeling better knowing that we're going to be turning over this world to you, because I know you're impassioned, I know you're bright, I know you're enthusiastic, and I know you know that there's problems. And so the challenge is trying to get us sort of more experienced people that have some experience to share with you the mistakes we made along the way so that you don't have to make those mistakes. So I think the environment's in for a reawakening. I think society's in for a reawakening. And I'm not saying this just because I'm here, but I think Villanova can do something really special. I sense the pieces are here for you to stand out and challenge the rest of the world and say, hey, listen, you know, we really believe that we can do things differently. I mean, I want to go down to Peru after listening to what they're doing down there, because I think it's going to be an opportunity to continue to do what has to be done. And my only advice to my colleagues from the Middle East is, I've been to Qatar and I've been to Saudi Arabia and I've been to Oman. The mistake they're making is they're trying to recreate what we've got with a little bit of money. What we've got doesn't work. Please don't recreate what we have. Do something that's very, very different. So get rid of the patient, protect the environment, and do what you feel you have to do. It's in your heart. You know what you have to do. Just get us out of the way and just do it. Isn't that a great?
Thank you. Thanks to the